afternoon. Good afternoon. We are embarking on the holiday season. 2 days from now, we will celebrate Thanksgiving, a day that families spend with each other and their friends around food. This press conference is focused on food insecurity in the state of Ohio and an opportunity that this state had to ensure that everyone had the security of food and nutrition in the state. Unfortunately, the governor has decided not to seek a waiver for the state of Ohio, not to ensure that every one of the 134,000 people who will be removed from our SNAP program as of January 1st. A little less than a half of those that are a part of our Medicaid expansion, the same group of people who need a little boost, need a little assistance. As we've looked at this issue, as the Senate Democratic Caucus, the House Democratic Caucus, but more importantly, as individuals who are concerned about our fellow Ohioans who are economically challenged, have not the resources, or do not have a job to support themselves and their families, we decided that we were going to do something to ensure that the message is out there in the public, that 134,000 people are going to lose their SNAP benefits. Disproportionately, this 134,000 are children, transitional age youth, infants and toddlers who will not have these benefits with their families. This is about the poorest of the poor in our state. There are 16 counties in the state where the governor has allowed for a waiver. 16 counties where individuals can get the additional food program, the SNAP program. But the rest of the state, unfortunately, will not have that opportunity. So our constituents will be discriminated against because they don't live in those 16 counties. We're calling on the governor today to expand the waiver to the entire state. At this time when we have one of the highest unemployment rates in the country, this is higher than it's been since 2012. Now is the time during this holiday season to ensure that every resident of the state of Ohio has the food that they need, not only to be healthy because it's a basic need, but also if we're going to expand Medicaid for the very poorest of the poor, one of the most fundamental needs is to have food. Those who have chronic diseases have to take medication. When you take medication, you need to have food. Most medications require that you eat before you take your medication. So we're talking about these individuals on Medicaid who can't eat because they won't have the food, won't have the ability to take their medications. So chronic disease costs will go up. And more importantly, for those who are interested in bending the cost curve, it will not be bent because people will be sicker without those medications and the food that they need. I'm going to next introduce my colleague in the Ohio House, Representative Dan Ramos.